Hello friends, welcome back to Learning Nails and Aesthetics. We are on chapter 4 in the Milady Esthetics book, Skin Foundations, Disorders and Diseases of the Skin. Starting on page 131, we'll be reading to page 138. Keep in mind, I am not AI, so mistakes will be made. Just laugh along with me. Also, check out my other videos. I have the Milady Foundations book, as well as their nail book, and some fun unboxing and other things. And we'll be doing a lot more things in the future. So let's get started. Describe the types of acne. Acne is an inflammatory skin disorder of the sebaceous glands, medically known as acne simplex or acne vulgaris. It is characterized by excess sebum. This excess oil and dead skin cells can clog pores. This excess oil and dead skin cells can plug pores, creating comedones, papules, and pustules, and cysts. This causes a growth of Propionibacterium acne, capital P period acne, bacteria. I know it sounds kind of strange if you're just listening and not following along, but the capital P period acne is in parentheses. Bacteria in the follicles are anaerobic. That is, the bacteria cannot live in the presence of oxygen. When follicles are blocked with sebum and dead skin buildup, oxygen cannot reach the bottom of the follicle. Sebum can irritate follicles and cause inflammation. As bacteria and inflammation grow, pressure is exerted on the follicle wall. If the wall ruptures, it becomes infected and debris spills out into the dermis. Redness and inflammation occur when the foreign debris created from dead white blood cells is detected in the skin, and white blood cells move in to fight the infection. Papules are red, inflamed lesions caused by this process. Papules may become more infected and pus develops. These infected papules become pustules. Pustules are filled with fluid from the dead white blood cells that fought the infection. Cysts are nodules made up of deep pockets of infection. Skin forms hardened tissue around the infection to stop the spread of bacteria, which can lead to both depressed and raised scars from damage to the dermal tissue. Because it is in the dermis, this variety of acne, called cystic acne, should be treated by a medical professional. Causes of clogged follicles. Acne is something your clients may have to deal with throughout their lives in various stages. It is important for you to understand the causes of acne and treatments to best serve your clients. Your consultation and assessment will be important as you develop a treatment plan that will take the causes of acne into consideration. Knowledge of the anatomy of the pilosebaceous unit gives you a deeper understanding of how acne behaves. Pilosebaceous unit is the term for the entire follicle that includes the hair shaft, sebaceous gland, and sebaceous duct or canal to the surface. The hairless follicle with attached sebaceous glands is the main follicle involved in acne. Clogged follicles are caused by many factors, including excess oil, retention, hyperkeratosis, and sebaceous filaments. Another reason follicles get clogged is that the opening, or ostium of the follicle may be too small to let infections out. Notable sebaceous gland conditions and disorders are discussed in the following sections. Type of clogged follicles. The types of clogged follicles include the following: comedo plural comedones, is a non-inflamed buildup of cells, sebum, and other debris inside follicles. An open comedo is a blackhead open to the surface and exposed to air. When the follicle is filled with excess oil, a blackhead forms. It is dark because it is exposed to oxygen and oxidation occurs. A closed comedo forms when the opening of the follicles are blocked with debris and white cells. It is also referred to as a whitehead, but should not be confused with the more hardened white type of papules called milia. Sebaceous filaments, similar to open comedones, are mainly small solidified impactions of oil without the cell matter. These filaments also block the follicle and can cause an acne breakout. They are often found on the nose. Milia are small epidermal cysts that appear as firm white papules. Milia are whitish, pearl-like masses of sebum and dead cells under the skin with no visible opening, and are often mistakenly called whiteheads. Whiteheads look similar but are soft. Hardened and closed over, milia are more common in dry skin types and may form after skin trauma, such as a laser resurfacing or chronic exposure to UV radiation. Newborns can sometimes get milia at birth or shortly thereafter. They resemble small sesame seeds and are almost always perfectly round. They are usually found around the eyes, cheeks, and forehead. Milia can also be caused by blocked follicular openings from oil-based moisturizers. Treatment for milia. Depending on the state, milia can be treated in the salon or spa. Increasing exfoliation and using a retinol product can thin the stratum corneum and gradually eradicate milia. Another treatment option is using an extraction tool to make a tiny opening in the epidermis to expose the milia. With gentle pressure, they usually can be removed from the opening. If they do not pop out, it is best to leave them alone, and they will often decompress with regular cleansing, exfoliation, and retinol application. Retention hyperkeratosis is a hereditary factor in which dead skin cells build up because they do not shed from the follicles as they do on normal skin. Additionally, excessive sebum production can overtax the sebaceous follicles and cause further cell buildup. Sebum mixed with cells in the follicle become comedones, plugs in the follicles. Consequently, open and closed comedones are formed. While not inflamed, these comedones are the beginning of acne problems if they are not treated with proper skin care to alleviate the impaction. Sebaceous hyperplasma involves benign lesions frequently seen in oilier areas of the face. They are often white, yellow, or flesh-colored. Sebaceous hyperplasma is described as donut-shaped with an indentation in the center. Sebaceous material may be found in the center. As cell turnover rate slows with age and androgen levels decline, this causes abnormal cell buildup with very little oil that crowds and enlarges sebaceous glands. Do not mistake these overgrowths of the sebaceous glands for comedones or milia, which may look similar at first. These harmless lesions cannot be removed by extraction. Cryotherapy, surgery, or laser are recommended treatment options. Seborrhea is a severe oiliness of the skin, an abnormal secretion from the sebaceous glands. When it is in the scalp, it is called dandruff or seborrheic dermatitis. But it can occur around the eyebrows, behind the ears, and around the nose or other areas of the face. It is not acne, although the inflammation in the skin from seborrhea can be misidentified as acne. Later in this chapter, you will learn more about seborrheic dermatitis. Grades of acne. Acne is graded on a scale of 1 to 4. Grade 1 acne is mild and usually treated with over-the-counter skincare, whereas Grade 4 acne has progressed to consistent breakouts and deep cysts that require medical intervention. Table 4-4, Grade 1 minor breakouts, mostly open comedones, some closed comedones, and a few papules. And there are pictures in this chart. So if you are just listening, if you're able to take a moment and look or replay the video later, or you could probably Google grades of acne and get some pictures that way. But like if you're driving, don't look. Grade 2, many closed comedones, more open comedones, and occasional papules and pustules. Grade 3, red and inflamed, many comedones, papules, and pustules. Grade 4, cystic acne, cysts with comedones, papules, pustules, and inflammation. Scar formation from tissue damage is common. Acne triggers: genetic, hormonal, environmental, lifestyle, certain products, and dietary influences affect acneic breakouts. During the consultation, you can ask questions about each of these subjects and learn more to develop a treatment plan to help your client. Educating your client about each of the following factors and getting your client's cooperation in making changes can improve acneic breakouts. Genetics. You need to know if your client's parents had acne during puberty or any other time, and whether other family members have acne. If acne is a familial disorder, your client's acne will be influenced by the DNA programming. Treatment for genetic influences. If acne has a genetic component, your client needs to understand that you can help get the breakouts under control, but curing the acne will not be possible. With a comprehensive approach that addresses the skin I always have a problem with this word. Holistically, your clients will experience the best improvement in their skin. Hormones. The androgen fluctuations during puberty, monthly menstrual cycle, hormone surges, pregnancy, and perimenopause contribute to oil production changes that can bring on comedones, papules, and pustules that usually evidence themselves periodically. Premenstrual water retention can cause slight swelling, enough to influence the epidermis and block filobaceous units. During the consultation, you may have to dig deeper to get a better understanding of hormonally induced acne. You may suggest your client see a medical professional for a change in birth control prescriptions. If the acne developed when the client started on a pill or an intrauterine device, an IUD, birth control, or following a hormonal injection. If the acne is a result of hormonal changes during pregnancy and perimenopause, you can let your client know that its severity will change as the pregnancy progresses and hormonal fluctuations shift. Your client may be able to influence the breakouts that occur from menstrual cycle hormone surges by limiting sodium intake and increasing water intake. Treatments for hormonal influences. Treatment options for hormonally induced acne include additional exfoliation to keep the stratum corneum thin so oil can escape to the surface more easily. Commonly, this includes chemical pills, enzyme pills, and microdermabrasion options. Home care products can include an antibacterial cleanser, salicylic acid-based products that are lipophilic, and water-based moisturizers. Environment. Working in an environment with poor air quality, pollutants, or comedogenic exposure can increase the inflammatory response of the sebaceous glands. Dramatic climate changes, including changing seasons, humidity, and temperature, influence oil production. Understanding your client's work environment is another aspect of the puzzle you will be solving when helping your client with acne. Does your client work around oils, chemicals, grease, or ink? Does your client work in an area with poor air quality? Is your client exposed to high levels of carbon dioxide from car exhaust in a city environment? Treatment for environmental influences. Encouraging your client to cleanse their face at the end of a workday to remove residual pollution, oil, grime, and other pore clogging factors can improve skin quality. Occlusive products may be too heavy and trap bacteria. Treatments that exfoliate as well as oxygenate the skin can help. The capital P period acne bacteria cannot live in an environment rich with oxygen. Lifestyle. Stress can stimulate the adrenal gland to produce more hormones, which leads to more oil production. Did your client recently start a new job or lose employment? Has your client had a romantic breakup or recently gotten engaged or married? Has there been a death in the family or loss of a close friend? A move to a new home or a new town? What about a challenging home situation? A long commute can contribute to stress. Adrenal glands that are consistently excreting adrenaline to keep up with the pace of an overly active lifestyle can create a hormonal imbalance that can affect the skin. Pressure or friction from cell phones, along with wearing hats or scarves and any other device or object that routinely touches the face, can transfer bacteria to the face and induce a breakout. Fragrances from dryer sheets, laundry detergents, or shampoos can cause sensitivity and a breakout. Treatment for lifestyle influences. Suggesting lifestyle changes to your client can help them find the triggers that stimulate an acne flare-up. Sometimes a simple fix, such as more frequent changing of a pillowcase, can make a difference. Cosmetics and skincare products. Certain ingredients in products can aggravate acne. Fatty ingredients, such as waxes and some oils, can clog or irritate follicles. These comedogenic ingredients can block follicles, which cause cell buildup, resulting in coma zones. Products rich in emollients and occlusive products are too heavy for skin prone to breakouts. Moisturizers and sunscreens should be lighter formulas, such as oil in water. Emulsions, not water in oil emulsions. Many makeup products are comedogenic, especially foundations and powders that are made with solids and fatty ingredients. Makeup products become contaminated with unhygienic application techniques. Products for hair and skin can trigger or irritate acne. Products are discussed thoroughly in Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. When you're removing a product from a jar, you should always use a spatula. It's really best to have product in a pump, but still don't touch the end of the pump where the product comes out. Treatment for product irritation. Educating your client on routine cleaning of makeup brushes and the use of disposable sponges to apply foundation can help with breakouts. Diet. An increasing number of studies are linking food allergies or sensitivities to acne. Foods with a higher glucose index, processed foods, foods with heavy iodide content, not iodine, and dairy are thought to be contributors to acne, although the relationship is not fully understood. Treatment for dietary influences. You are not a nutritionist or dietitian, unless you are, of course, legally licensed. But you can encourage your clients to eat a healthy diet and drink plenty of water. You can suggest clients see a specialist for dietary changes that may improve the health of their skin. Medicated treatment options for acne. Regular skin care sessions with exfoliation and incorporating modalities like high frequency, microdermabrasion, and chemical peels can help keep the stratum corneum thin, keep oil production under control, and hydration, and oxygenate the skin to eliminate bacteria. Electrical devices and chemical exfoliation are covered in Chapter 10. Facial devices and technology and Chapter 13, Advanced Topics and Treatments. However, treatment options for acne can also include a collaborative approach with medical professionals and the esthetician. They are varied and include the use of topical antibacterial agents to eliminate the P. acne. That's the capital P acne bacteria. Antibiotics can be used both orally and topically. The potential for developing antibiotic resistance is the reason why medical professionals are reducing the use of these drugs to treat chronic acne. If the client acquires a serious infection later in life, antibiotics might not work to fight the infection because of the antibiotic resistance that developed during the long-term use to improve the acne. Table 4-5, common medications used in the treatment of acne. Adapalene, also differin, a topical peeling agent similar to retinoic acid, may be less irritating than tretinoin. That's the action of the drug. And the potential side effect is drying, redness, and irritation, and photosensitivity. That means sensitivity to sunlight. I am not familiar with a lot of these, so azelaic acid, a topical acidic agent that flushes out follicles, and the potential side effects are drying, redness, and irritation, and photosensitivity. Birth control pills, an oral medication used to regulate the androgen hormone that impacts oil production. Potential side effects: irregular periods, weight gain, and cramps. Slatomycin, topical antibiotic that kills bacteria. Its side effect is it's very drying. Isotretinoin, an oral controlled medication used for severe acne, requires close medical monitoring, including lab work to check liver function due to its toxicity. Note: used as a last resort for severe acne. Potential side effects: severe dryness, birth defects, possible depression, possible suicidal thoughts, and potential for ulcerative colitis. Requires participation from both the patient and the medical provider in a mandatory Food and Drug Administration risk management program. Spironolactone, an oral medication used to regulate the androgen hormones that impact oil production, typically prescribed for young women and teens. Potential side effects: irregular menstrual periods, breast tenderness, male pattern facial hair growth, and dry mouth. Trazodone, another retinoid, a topical peeling agent that may be less irritating than tretinoin. Drying, redness, and irritation, and photosensitivity. Tretinoin, which is Retin-A, A topical vitamin A acid, a strong peeling agent that is drying and flushes out follicles. Very drying, causes redness and irritation and photosensitivity. Considerations for medicated acne treatment. You can't cure acne, but you can help control the breakouts. The passage of time is often the cure. As a teen moves out of puberty, perimenopause transitions to menopause, or stressful lifestyle habits change. You can help your clients have more confidence in social situations with clearer skin. More information on acne medications available to clients include the following. Home care products should include ingredients with benzoyl peroxide and vitamin A products like tretinoin, retinoids, and adapalene. Moisturizers and serums that are low on the comedogenic scale are best. Skincare ingredients are discussed in the chapter on Chapter 6, Skincare Products, Chemistry Ingredients, and Selection. Benzoyl peroxide products are often combined with topical antibiotics. This combination helps reduce the chances of developing antibiotic resistance. Topical antibiotics alone aren't typically prescribed. These products should be applied in the morning because they can discolor pillowcases. Vitamin A products should be applied in the evening because they are photosensitizing. Clients should apply a very small, pea-sized amount beginning twice a week, increase the application to 3 times a week, then use the product every other day, and finally, every day as tolerance to the product is developed. These products work by thinning the stratum corneum, increasing cell turnover, and preventing hair follicles from becoming clogged with sebum and dead skin cells. Salicylic acid and azelaic acid are both antibacterial. Salicylic acid is a lipophilic, so it works to digest sebum. Oral medications to help with acne, in addition to antibiotics, are often drugs to counter the effect of androgen hormones. An example is spironolactone. Birth control pills are another prescription medication that can influence acne, reducing breakouts from hormonally induced acne. Check-in. Explain the difference between an open and a closed comedone. Describe the 4 grades of acne. Give examples of 3 different kinds of medications used to treat acne. That'll do it for this video. We will continue in future videos. Don't forget to comment, like, share, and subscribe, and check out my other videos. I appreciate you watching. I hope this was helpful to you, and have a great day. Thanks. Bye.